When I first met Dr. Zarkowski, he was in Colorado.
That's right.
And then he moved out to California. He was working for a big hospital system. And what made you decide to go from the hospital system to an office-based lab?
Yeah. Listen, Kim, this is the fundamental question about vascular disease that is confronting patients and doctors. And it's the idea that access to care is a real challenge for
Yeah,
folks that can't walk.
yeah,
And so what I noticed is that the majority of my patients in the area were coming from outlying regions, not La Jolla, not San Diego, but El Cajon, um, Rancho San Diego, Fallbrook, Temecula. And, these folks would tell me every time I saw them, do I really have to come down to the city? Do I really have to go to, major hospital? Do I really have to go to even minor hospital?
yeah.
And I said, well, this is where I am. And I would give them the company line, but it wasn't satisfying. And I found that people wouldn't come back because of the challenge of getting to somebody to take care of their legs. And that's really what made the decision for me is I'm fundamentally here to be a doctor and take care of people and be useful. And if I'm not where I am needed, then I'm not useful.
What is the difference for people who don't know? We were just talking about this actually before the live stream started. What is the difference between being treated in a hospital versus an office-based lab? And then also the third is the ambulatory surgical center or ASC.
Sure. I think an ambulatory surgery center is a very similar environment to an OBL. There's a layer of complexity when it comes to regulation that an ASC has added to it. But both are similar in the sense that it's a more personal touch than a system. And that's really what is important to me is that when I see a patient, they're coming to see me to be their doctor. That's the experience that's gratifying for me, especially when I can help somebody. And so from a satisfaction standpoint for quality of care, for me as the doctor, I much rather you come to see me rather than hospital system. I think for the patient, what I got in talking to people is the challenge of navigating, major hospital or even minor hospital, the difficulty associated with getting somebody on the phone. And so something that I do for my patients is I give them my cell phone. I have my phone, I'm sure will go off. It'll buzz in my pocket. One of my patients will be calling me with a question. And the reason I do that is because there's 11 layers of protection between me and the patient when I'm in a system versus, a text message or a phone call that really takes me 30 seconds to answer a question. And so I think for a patient, that is the real difference between coming to an office-based lab or an OBL or an ASC type of setup.
And it's interesting. I'm going to ask him a really loaded question because there's so much controversy around the office-based labs these days. There was a New York Times article that came out. There were some ProPublica articles that came out where they were talking about overutilization of tools for, monetary reasons at some of the office-based labs. And there were a lot of, quite a few OBLs that went out of business because of this controversy. There were some issues with the referring centers like primary care and podiatry not wanting to refer. You have done this literally right in the thick of the controversy. How difficult was it for you in making that decision? And what hurdles did you have to overcome in order to get this office-based lab opened up?
Sure. In all walks of life, you find people who make good decisions. You find people who make bad decisions. It's not something that's particular to office-based lab versus hospital system. It happens in politics. It happens in law.
Yeah.
And what we need to remember as doctors, as patients, is it's the person taking care of you and the quality of their care that matters, not the setting, not the type of place that you go to. And really understanding that there are many factors that go to taking care of a leg that has vascular disease that don't necessarily relate to where it's done.
Yeah.
And that's never going to change.